At the level of the eye, the topical instillation of atropine may cause a mydriasis, that it is known as the dilation of the pupil of the eye. Plus, it causes also a lack of light reflex, and it causes cycloplegia. This is the cycloplegia, as you can see in the scheme, that it is represented by the paralysis of the ciliary muscle of the eye, resulting in a loss of accommodation that lasts for 7 to 10 days. This results in a photophobia, which is a light sensitivity and intolerance of light, plus blurred of near vision. An intraocular tension tend also to augment, specifically in the narrow angle glaucoma. Regarding the smooth muscle, the action of atropine on all visceral smooth muscle make them relaxed, specifically when it blocks the M3 receptors. The contraction, the tone and the contraction of the stomach and intestine are also reduced by the usage of atropine. The passage of chyme is slowed and the constipation may occur. So imagine that when the atropine is taken, then it causes a decrease in the peristaltic movement of the intestine and the stomach, causing an accumulation of the food and of the chyme inside our digestive tract, making or exciting or decreasing the excitation of the intestine, causing a constipation and a spasm that may be relieved. The atropine caused also a bronchodilation and a reduction in the airway resistance, specifically in the patient having a chronic obstructive pulmonary disease and those having asthma. The atropine has also an action on the urinary bladder and on the ureter. It may cause a relaxation of them. So the relaxation of a urinary bladder make the bladder capacity increased. So the urinary will be then accumulated inside the bladder, causing a urinary retention that may also occur, specifically in older male with benign prostatic hyperplasia, BPH. Relaxation, it may cause also a relaxation of biliary tract and uterus that is a minimal effect. Regarding glandular secretion, the atropine may cause a reduction in the secretion of sweat gland, salivary gland, tracheobronchial, and lachrymal secretion, specifically when it blocks the M3 receptor. Regarding skin and eye, they become dry. Talking and swallowing may be also difficult. It has also an action on the gastrointestinal secretions. The secretions will be reduced, such as the secretion of pepsin, of mucus, and of HCl. Regarding the body temperature, it is raised, specifically when the atropine is used at high dose. This increase in the body temperature is due to the inhibition of sweating glands, as well as the stimulation of the temperature that regulate our body from its center, that it is present in the hypothalamus. The atropine also act as a local anesthetics. So it has a mild anesthetic action specifically on the cornea. Now regarding the pharmacokinetics of the atropine, remember that the pharmacokinetics is composed of 4 elements: A for absorption, D for distribution, M for metabolism, and E for elimination. The atropine is absorbed rapidly by the gastrointestinal tract and cornea when it is given on topical application. Regarding its distribution, when the atropine reaches the blood, then it will be distributed and it has the capacity to cross the blood-brain barrier and produces then a central nervous system effect. And regarding its metabolism, it will be metabolized in the liver at 50% approximately. Regarding its elimination, it is eliminated, the major route of atropine elimination is the urine, as it is eliminated as metabolite or unchanged. And the half-life for this elimination is between 3 to 4 hours. Regarding the dose that it has to be given and the preparation, usually it is the atropine sulfate, and it is given between 0.6 and 2 milligram by injection, such as either by using either intramuscular or intravenous injection. The dose recommended for children is 10 microgram per kilogram, and when it is given topically in eye, we have to use an atropine sulfate solution at 1 or 2%. The therapeutic uses, then we can conclude, depending on the actions of the atropine, that the atropine can be used in ophthalmology as ophthalmic. An the atropine, a topical solution, is used and it exerts both mydriatic and cycloplegic effect. Regarding the atropine, note that the atropine has a prolonged mydriasis effect observed with atropine, and it is between 7 to 14 days compared to 6 to 24 hours when using another agent other than the atropine, such as cyclopentolate, which is a shorter acting antimuscarinic agent. The atropine can be also used as antispasmodic to relax the gastrointestinal tract. It can be also used in cardiovascular treatment to treat bradycardia of varying etiologies. As I said also, it can be used as antisecretory agent because it blocks the secretions of the upper and lower respiratory tracts prior to surgery. The atropine can be also used as antidote for cholinergic agonist, and this part was explained in the chapter concerning the cholinergic drugs. So the atropine is used for the treatment of mushroom poisoning, for example. So you know that in nature we have certain mushrooms that contain cholinergic substances that block cholinesterase. So massive dose of atropine are required over a long period of time to counteract a poisoning with those mushrooms. The atropine has also the ability to enter the central nervous system. This is really important in treating the central toxic effect of the anticholinesterase. The atropine has also many adverse effects, and those adverse effects are depending on the dose. It may cause dry mouth, blurred vision, tachycardia, urinary retention, and constipation. As well, the atropine has effects on the central nervous system. It may cause restlessness, confusion, and hallucination that may progress to depression. It may cause also collapse of the circulatory and respiratory system. The atropine may be also dangerous in children because it leads to a rapid increase in their body temperature. The toxicity of the atropine may be also overcome by using low doses of cholinesterase inhibitors, such as physostigmine.